Welcome to our important video, the 6 most common causes of diabetic ankle swelling, and 6 amazing remedies to fix it. Do you suffer from swollen ankles or puffy feet? Were you aware that there are many causes to this painful condition, and most are very connected to your blood sugar control? Tender, inflamed, and puffy tissue around your ankles and feet is no joke. It can make every step feel extremely painful. And your current diet and lifestyle habits may be making it worse. So what are the exact reasons behind swollen feet? And what can you do to remedy this potentially painful situation? We're about to reveal the true reasons behind your puffy ankles. And be sure to stick around to the end of the video to learn about 6 proven and natural remedies to help you correct this most uncomfortable condition. Please like and subscribe. And click the link in the description box below for 3 free diabetes-fighting gifts. Now, let's not drag our feet any longer. These are the 6 most common causes of diabetic ankle and foot swelling, and 6 amazing remedies to fix it. Why are your glucose levels so tied to the health of your feet? Well, that's largely due to the fact that chronic high blood sugar can damage arteries, which supply blood and oxygen to leg muscles and nerves. We'll go deeper into this subject in this video, as diabetes can create a cascade of issues that may lead to swollen ankles. But if you already suffer from diabetes, a main cause of foot swelling could be medication side effects. Have you heard of peripheral edema? This is swelling in extremities due to a buildup of fluid in between cells, and studies show that it can be a side effect of taking certain pharmaceuticals meant to treat symptoms of diabetes. Unfortunately, certain diabetes medications, including TZDs and sulfonylureas, have been found to increase the risk of fluid retention in hands and feet. Even taking prescription insulin has been shown to raise the risk of peripheral edema. These medications carry this unwanted side effect because they have the ability to create changes in sodium and water balance inside the body. They may also cause vasodilation, or the expansion of blood vessels. This can cause capillary permeability, where fluids leak out of blood vessels and into surrounding tissues. What other drugs might lead to fluid buildup in your feet? We'll tell you shortly. But now, let's reveal another major link between diabetes and swelling in the feet: diabetic neuropathy. Diabetes-related nerve damage can really do a number on your feet. That's because prolonged exposure to high levels of glucose in the bloodstream damages nerves throughout the body, including in the legs. Over time, this can lead to diabetes-caused neuropathic symptoms. In fact, neuropathy is estimated to affect about 50% of the diabetic population. This condition can lead to inflammation, which may compromise the function of the lymphatic system, a part of your immune system that works to maintain fluid balance in tissues. So, lymphatic dysfunction can impair the removal of fluid from your hands and feet. Diabetic neuropathy can also disrupt blood circulation, which may impair your blood vessel dilation and constriction, which may then cause fluid accumulation in your legs and feet. Plus, this condition can create debilitating discomfort and pain, potentially limiting your physical activity. Studies show that reduced muscle contractions can lower the amount of blood and fluids returned from the legs, potentially leading to fluid pooling in the lower extremities. So what else is going on inside your body that may be causing your swollen feet? That's coming up next. First, let's investigate the other drugs that affect your glucose control and your feet: caffeine and alcohol. Yes, caffeine and alcohol can rightly be classified as drugs because they create pharmacological effects on the human body, including the possibility of fluid retention in the feet. Caffeine intake can disrupt your balance of electrolytes, especially sodium and potassium, which may create fluid buildup in legs. And like some medications, caffeine and alcohol have both been found to create vasodilation, which can lead to increased capillary permeability, which allows fluid to leak into surrounding tissues. Alcohol consumption has also been linked to an increased risk of becoming deficient in certain essential nutrients, especially thiamine, which can further contribute to conditions that cause fluid retention. Heavy drinking may also lead to dangerous issues with your heart and liver, and we'll talk more about those in just a moment. Plus, caffeine and alcohol are both known diuretics, meaning they can cause increased urination, which may then lead to dehydration. Though it sounds counterintuitive, dehydration can actually cause the body to retain water, potentially leading to fluid accumulation in tissues of the ankles and feet. So, what are the methods for reducing swelling in feet? Stick around, because we're about to break down the 6 most effective treatments for swollen ankles. First, what does diabetes have to do with your vital organs and the risk of ankle swelling? Well, for so many reasons, you should be mindful to avoid heart disease, kidney disease, and liver disease. Chronic high blood sugar levels can damage the liver and may lead to conditions like non-alcoholic fatty liver disease and cirrhosis. This may result in impaired protein synthesis, which in turn can lead to fluid imbalances and a reduction in levels of albumin, a protein made in the liver. Studies show that low levels of this protein can lead to fluid leakage in tissues. Diabetes can also lead to renal complications, including diabetic nephropathy, or a deterioration in kidney function due to diabetes. This can harm your body's fluid balance, potentially leading to sodium and water retention and swollen feet. And naturally, being diabetic increases your risk of cardiovascular diseases, including heart failure. If your heart is not functioning efficiently, it can compromise blood circulation and may result in a backup of blood in your veins. This, in turn, can lead fluid to leak out of your blood vessels and into surrounding tissues, especially in the legs and ankles. Heart disease can also damage endothelial cells, or the protective lining of blood vessels. And endothelial dysfunction has been shown to lead to increased blood vessel permeability, thus raising the risk of swelling in the feet. Of course, as diabetes is intricately linked to the health of your blood vessels, another manner in which chronic high blood sugar can lead to swollen ankles is microvascular damage. Complications to your microvascular system, or the series of small blood vessels in your body, including arterioles, venules, and capillaries, can significantly impact your fluid balance, potentially leading to peripheral edema. This network of microvessels are meant to regulate local blood perfusion in your skin and subcutaneous tissues. But chronic high blood sugar can compromise this network, potentially disrupting the delicate balance between fluid filtration and fluid drainage in your skin and subcutaneous tissues. Elevated glucose levels can increase the risk of hypertension or high blood pressure, which can damage microvessels in your feet, further increasing the risk of fluid leakage and ankle swelling. Microvascular damage can also trigger inflammatory responses that can cause the release of certain signaling molecules, which may then increase blood vessel permeability and swelling. This leads us to a major overall link between diabetes and swollen feet, and that is chronic inflammation. Research proves that there is a strong connection between diabetes and persistent internal inflammation. High blood sugar and increased insulin resistance have both been shown to induce the release of pro-inflammatory cytokines, which can contribute to a sustained inflammatory state in your body. These inflammatory cytokines can damage the endothelial lining of your blood vessels, potentially allowing fluids to leak into tissues around your ankles. As previously mentioned, diabetic neuropathy can also lead to chronic inflammation and may cause damage to your lymphatic system, potentially resulting in fluid drainage in your hands and feet. Well, now you can see that there are many links between diabetes and swelling in your feet. But the big question is, what can you do about it? So let's get right into 6 amazing remedies to fix your swollen feet. First, and perhaps most importantly, to remove fluid from your feet, you must hydrate. It may sound ironic, but a main way to beat water retention is to drink more water. Dehydration can cause blood to thicken, making it more difficult for your cardiovascular system to circulate your blood. This can lead to fluid retention in your legs. Many diabetics suffer from chronic dehydration, as high blood sugar levels force the body to produce and expel more urine. Doctors recommend drinking at least 8 cups of water spread over the course of your day. This works to thin your blood while reducing the risk of swelling and discomfort in your extremities. What else should you put into your body to get that excess fluid out of your feet? The answer is just ahead. But here's something you should definitely get less of if you wish to reduce ankle swelling: salt intake. Excess salt consumption can force your body to retain water. That's because high sodium levels in your bloodstream will force your body to maintain equilibrium, or fluid balance. This leads to fluid accumulation in between cells. The American Heart Association recommends consuming no more than 2,300 milligrams of sodium daily. That may sound like a lot, but it's actually only equal to about 1 teaspoon. So chances are you are unknowingly consuming too much salt every day. And excess sodium can lead to a wide range of diabetes-related health issues, including fluid buildup in the extremities. Now, to reduce ankle swelling, you should consider getting more magnesium, potassium, and herbal remedies. Magnesium plays a crucial role in maintaining electrolyte balance, which is essential for proper fluid distribution throughout the body. Studies show that having high blood pressure and lower levels of magnesium can greatly increase the risk of edema, and magnesium supplementation has been found to significantly reduce peripheral edema. Research has also found that getting enough potassium can aid sodium regulation and fluid balance. Even certain herbs like turmeric, ginger, dandelion, and even horse chestnut have been found to supply anti-inflammatory and antioxidant properties that can work to reduce swelling while improving blood circulation. Want to know the method for soothing foot pain and skin irritation while also reducing ankle swelling? That's coming up next. First, let's discuss the importance of exercise. Moving your legs causes your muscles to contract, which helps to pump blood and fluids away from your feet and back up your body. Essentially, exercise enhances lymphatic flow, which can result in decreased edema. And naturally, regular physical activity can aid weight management while lowering chronic inflammation, further reducing fluid buildup. On the flip side, not moving enough throughout your day could allow gravity to take control of your excess fluids, potentially pulling them in your feet. But studies show that even just a bit of moderately paced walking can work to activate calf muscles, which will then pump fluid away from your feet. Other lower body movements, including swimming, cycling, and even yoga, have also been found to improve circulation, which in turn can reduce swelling in your feet. At the end of the day, what can you apply to your legs to reduce painful swelling? The answer is next. But first, be sure to utilize essential oils and massages. Studies show that massaging your legs can stimulate your lymphatic system, thus helping your body move excess fluids away from your feet. And massaging your legs with essential oils like eucalyptus, peppermint, or lavender may further improve your blood flow while reducing swelling in the affected areas. Essential oils contain powerful anti-inflammatory compounds, which have been shown to aid skin health and blood circulation when applied topically. They may also provide cooling and pain-reducing effects to damaged nerves. Now, here's something anyone and everyone can do for their feet to reduce pain and swelling. Use compression socks. These store-sold medical socks work by applying pressure to your legs, which helps to improve circulation while preventing fluid buildup. In fact, the European Journal of Vascular and Endovascular Surgery found that compression therapy significantly reduced edema for participants with chronic venous disorders. Compression socks can be especially beneficial for you if you tend to spend long periods of time sitting or standing throughout your day. They have also been found to provide comfort, reduce swelling, and improve blood flow for those who suffer from diabetic foot ulcers and other diabetes-related foot conditions.